My name is Dr. James Cambion Bayadzirere Ndotasanura, formerly known as Dr. James Cambion Bayadzirere Mtetwa. I qualified in 1979 at Godfrey Hagen School of Medicine, University of Zimbabwe, and I've been since then practicing as a medical practitioner, general practitioner. During that time, I met so many cases which were sort of difficult to manage and treat and help a patient conclusively. For example, in children, there's this thing called NOAA. We interpret that as dehydration. But even if you corrected the dehydration, you may even fail to save the child, which means there is something else deeper, which scientifically we are not attending to. And in adults, we do see a lot of other problems or illnesses which we think should actually respond well with this kind of treatment, but they fail to respond successfully. So initially, most patients would go away, seek help elsewhere. Some will refer to consultants. They come back, they are not really 100% well. Some take themselves to traditional healers, and when you see them later, they are much better than you last saw them. They ask, where did you get help? What medication was used? And they tell you they've been to traditional medical practitioners. From there, you always remember teachings from Professor Michael Gelfand, who really stressed that in Africans, if the diagnosis is not clear and if the illness is not responding to scientific medicine, the patient should visit traditional practitioners. So it came a time really when you would just make a suggestion to a patient. Look, scientifically we've done all the tests and x-rays and whatever you know, and we thought the diagnosis means this, but you are not responding accordingly to the treatment. If you are free, you can try traditional medical practitioners. During those years, I'm saying about 1981, started both practicing at Machipisa Shopping Center. And that's where I really met a lot of different diseases, which will then make you think, because every patient that comes to you, you want to see that person cured, well and happy. But if you fail, when you've done all the tests and the x-rays, I always remembered Professor Michael Gelfand's teachings that if the diagnosis is not conclusive and if the person is not responding to treatment accordingly, you can refer to traditional medical practitioners. And during that time, a lot of patients would voluntarily go on their own, unknown to you, to seek the help of traditional medical practitioners. And the next time they visit you, their ailment would have gone or improved. And they would ask, which doctor did you go to and what medications were you given? They'll tell you, no, I went to see a traditional medical practitioner. Which really convinced me further that what Professor Michael Gelfand said is very true. But the cracks came during the time of HIV/AIDS. We really had no answer in the 1990s. And I said, okay, let's try what Professor Michael Gelfand said, that if there is no scientific cure or scientific drugs that will help the ailment, try the other world, the world of traditional medical practitioners. And I would advise my patients accordingly. Not that the traditional medical practitioners had a cure for virus, no. But anything that would make the disease progression slow down or improve health or clear the opportunistic infections. And yes, we had some results, especially in clearing opportunistic infections. And those who visited traditional medical practitioners, they would come back and tell you that, look, this was caused by Mombeomai. And since then, we've paid that Mombeomai, and things have taken a turn for the better. Like, they will still be having the virus, but health-wise, they would have improved tremendously. Right? And that was before the coming on board of antiretroviral drugs. So it then really proved to me that traditional medical practice or herbs are very relevant to helping patients, whatever the ailment, because we've got antibiotic herbs and we have got antipyretic herbs and so forth and so forth and so forth. They will still work, they will help, right? This is what the grannies and whatever you know would use as the first thing at home before coming to hospital to see a doctor. So they are relevant. And combining traditional medical practice or our traditional herbs with scientific medicine to whatever ailment the patient has would work for the better of the patient. So from that experience of the 1990s, I was very convinced that the traditional medical practice and herbs are complementary to scientific medical practice and scientific medicines. And I took a very keen interest then at that time. Those who did not mind, they would invite me when they go to seek help from the traditional medical practitioners. And because I wanted to know more, right? What is causing the problem and what is behind that ailment. And I did learn quite a lot. In the early 20s, the early 2000s, I had grown a very keen interest in actually continuing that research in how traditional medical practice work. So it was through that research that the founder of Prometra Zimbabwe heard about me. We met, we discussed, I told him my experiences, and he was interested in working with me. And we established Prometra Zimbabwe, which is the 28th chapter of Prometra International in 2016. And they invited me to head the department of research and development. That's what I'm there for. I think most traditional practitioners, long time ago, when they submitted their herbs, they failed to get any response or feedback, and they would feel that this person has gone away with my knowledge of this herb and how to use it, and is actually using it. So yes, they are skeptical. If a way can be found that a herb which has been used for a specific disease treatment is then tried, right, and proven to be very useful, then that person must be given whatever rights to that herb. Right? If that is established to the satisfaction of traditional healers, then yes, they will come aboard. But yes, there is very, very this big fear that we are giving away our knowledge. Right? And most of these people, that knowledge is being given by their ancestors. So they are very protective about it. But yes, we do encourage that if something can be established, or Ministry of Traditional Medicine or in the herbs or whatever, and to combine traditional medicine and scientific medicine in one clinic or one hospital, so that they actually work together, that will start bridging that gap that exists today. We need to learn from the Indians and from the Chinese how they've bridged the gap, right? And maybe you might get one or two clues, right? But what I want to stress is scientific medicine, we've learned it from the books in order to understand what the disease is, what treatment is needed, or whatever management is needed. But traditional medical practice, yes, they know herbs, but the method of making a diagnosis is very different. Theirs is spiritually inspired, right? And sometimes a patient doesn't need to say anything, just walks in, sits down, and the traditional practitioner or healer starts telling you that you are suffering from this and that because of this and that and whatever you not, right? And he starts managing the patient according to what he has been inspired spiritually, and the patient gets well. So there is a difference. The two systems are very different, right? Yes, we need to weed out bogus traditional healers and really remain with those who are authentic. But once we've got a group of authentic practitioners, there is no problem in combining traditional medical practice and scientific medical practice in the same hospital. And that's what we need to see. If it takes legislation, then we are really crying for that. And in fact, this is strongly supported by the World Health Organization, that the two practices should combine, should work together. After all, really, 95% of people in Africa, they use herbs for day-to-day ailments, and they get well. So why not combine the two? And we would urge seriously our government to look at this very, very seriously. Whatever it takes, if it means combining the traditionalists, right, together with the scientists, try to work a way forward, having learned one or two from the Indians and the Chinese, then the sooner that is done, the better for the country. After all, the country can earn billions of dollars from processing and exporting proven herbs which are abundant in this country.